Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Tacrolimus. Its brand name is Prograf. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Tacrolimus. We'll then touch on examples of dosing and finish it off with side effects with percentages. I've put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So Tacrolimus provides immunosuppression via inhibition of T lymphocyte activation and proliferation and T helper cell dependent B cell response. In terms of indications or reasons we would prescribe this medication to a patient, well, we would often see this medication prescribed in the treatment of moderate to severe atopic dermatitis. As well, it can be used prophylactically to prevent cardiac transplant rejection, liver transplant rejection, as well as renal or kidney transplant rejection. With respect to contraindications or reasons we would not be able to prescribe tacrolimus, well, first of all, we wouldn't give this medication to a patient who had a hypersensitivity to tacrolimus or to any other component of the formulation. As well, if a patient had a hypersensitivity to polyoxyl 60 hydrogenated castor oil with the IV formulation, then they would not be able to use that IV formulation. Now for examples of dosing with tacrolimus. So in the treatment of atopic dermatitis, we would typically see instructions to apply a thin layer of the 0.03% or 0.1% ointment topically to affected areas twice daily. You would then re-examine in 6 weeks. For liver transplant rejection prevention or prophylaxis, we would see an initial dose of 0.1 to 0.15 milligrams per kilogram per day orally in 2 divided doses given every 12 hours. And they would wait at least 6 hours after the transplant to initiate therapy. As with all medications, there are some side effects or adverse reactions that patients may experience while using tacrolimus, so we'll go over some of those here now. 6 to 36% of patients may experience peripheral edema, and alopecia may happen in up to 29% of patients. Up to 28% of patients may experience skin redness, and a rash may happen 10 to 24% of the time. Up to 40% of patients may experience constipation, and up to 72% may experience diarrhea. Anemia may happen up to 50% of the time, and 9 to 64% of patients may experience a headache or insomnia. A tremor may happen 15 to 54% of the time, and some patients may develop a more frequent cough. The more serious side effects would be atrial fibrillation, hepatotoxicity, a prolonged QT interval, or hypomagnesemia, which would be low magnesium levels. Alright everybody, that's all we're going to talk about today with Tacrolimus or Prograf. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. For today, take care.